Today, the Select Subcommittee is holding a hearing to examine the drafting, publication, and critical reception of the publication entitled The Proximal Origin of SARS-CoV-2. Proximal origin came to two primary conclusions. First, that COVID-19 is not a laboratory construct or a purposefully manipulated virus. And second, that no type of laboratory-based scenario is plausible. This is not an attack on science. It's not an attack on peer review. And it's not an attack on an individual. We're examining whether government officials, regardless of who they are, unfairly and perhaps biasly tip the scales toward a preferred origin theory. We're examining any conflicts of interest, biases, or suppression of scientific discourse regarding the origins of COVID-19. And we're examining the science of proximal origin, because while I believe it's not solely a scientific question, the science behind the origins is vital. In one word, we're examining the scientific methodology applied to the origins question. In my mind, at this point, I view the processes to be flawed. If we're to do better in the future, we must make every effort to mend our flaws. And overall, we're examining whether scientific integrity was disregarded in favor of political expediency, maybe to conceal or diminish the government's relationship with the Wuhan Institute of Virology, or perhaps its funding of risky gain-of-function coronavirus research, or maybe to avoid blaming China for any complicity, intended or otherwise, in a pandemic that has killed more than 1 million Americans and has had a crushing effect on all of humankind. In the earliest stages of the pandemic, scientists and public health authorities raced to understand this novel coronavirus, called novel for good reason, to understand how it spread, who was at risk, its origins, and most importantly, how to prevent loss of life. As work advanced gradually on most of these fronts, the origins question stalled. Did it come from a natural spillover transferred from a bat to an intermediate source to a human? Or was it the result of a laboratory or research-related accident? In other words, did it come from a lab? Honestly, we may never know with 100% certainty the origins of COVID-19. Especially without full, legitimate cooperation and transparency from all involved. However, we do know some things for certain, that the drafting, coordination, and publication of proximal origin and downplaying the lab leak was antithetical to science. Not my words. That's what Dr. Redfield, the former CDC director and renowned virologist, testified to our Select Subcommittee in March. He testified that science never selects a single narrative. We foster debate, and we're confident that with debate, science will eventually get to truth. Did we do that? That wasn't the case with proximal origin. Dr. Anderson, testifying today, wrote that the author's main work over the past couple of weeks have been focused on trying to disprove any type of lab theory. While it's true that the scientific method consists of raising a hypothesis and then testing the hypothesis, often through falsifiability, it's not true nor appropriate to make definitive conclusions based on falsification process, riddled with assumptions. Assumptions are not science. To be clear, the goal of science is to prove and disprove. Regardless, it would be seemingly misleading to assume that proximal origin proved or disproved anything it sought to test. Its conclusion is flawed as it relies on unsupported assumptions, including guessing what a hypothetical scientist would do in hypothetical experiments. The facts are that the authors of Proximal Origin ultimately took a one-sided educated guess. They guessed that in the previous 3 years, science would discover a furin cleavage site in a SARS-related viruses, and didn't. They guessed that maybe the WIV, Wuhan Institute of Virology, wasn't working with pangolin viruses, and they were wrong, as related by ODNI, the Office of the Director of National Intelligence. Perhaps most troubling, it appears that the authors' views on a potential lab leak changed abruptly after the February 1st conference call with Drs. Fauci and Collins. The authors continued their pursuit to disprove the lab leak theory and fully support the nature theory, employing faulty assumptions and willfully ignoring circumstantial evidence that tended to support a lab leak hypothesis. Why? Why? They also tended to act more akin to politicians than scientists. Dr. Rambo, Dr. Fauci, Dr. Collins all expressed concerns that the lab leak theory, if verified, would have significant international political implications, particularly for China. Dr. Fauci also wrote that downplaying a lab leak would limit the chance of new biosafety discussions that would unnecessarily obstruct future attempts of virus culturing. These are quotes. Why try to avoid biosafety discussions when people are dying? Science should be clear, even when politics are not. On April 16, Dr. Collins expressed dismay that Proximal Origin didn't fully squash the lab leak theory and asked Dr. Fauci if there was anything more they could do to put it down. I want to pause on anything more we can do for a second. That would suggest that they already did do something. Maybe this was a reference to Proximal Origin. I don't know for sure. But on the very next day, on April 17, 2020, Dr. Fauci cited Proximal Origin from the White House podium when asked if COVID-19 leaked from a lab. He used Proximal Origin to downplay the lab leak theory. Why? Based on what absolute truth? The question as to the origins of COVID-19 is fundamental to helping us predict and prevent future pandemics, protect our health and our national security, and prepare the United States for the future and to save lives. I look forward to a strong, on-topic discussion today.